In this video, we're going to talk about the general format of the questions that are being asked and how do we answer those questions. The first format of question is a very small question which allows you to discuss about history, physical examination, what you're thinking about, versus the second nature of the question in which you have been provided a lot of information and they want to move to the next level. For example, the scenarios can be as simple as there's a 55-year-old female who presents to your ER with right lower quadrant pain. You're asked to evaluate the patient. Versus the question being, there's a 55-year-old female who presents to your ER with right lower quadrant pain for 2 days. She also has some nausea. On examination, she is tachycardic. She has a right lower quadrant tenderness. On labs, white cell count is 18,000 and an X-ray of the abdomen which shows an appendiculate. Now, there is a different way you answer both the questions. In the first question, you're allowed to ask that I'm going to see this patient and I'm going to ask this patient about any other symptoms associated with pain, such as nausea and emesis. And if she's having any flatus or bowel movement, I would like to know any previous colonoscopies, about her physical examination, especially her abdomen and her rectal exam. And I would then also look at her vitals. And then I will order a lab such as CBC because I want to see her white cell count. So that is the answer that you can give for the first question. Now for the second format, he has already given you a lot of information. So in that question, you should proceed as, you have already given me an adequate history and a physical examination along with laboratory data. I'm concerned this patient has appendicitis. I would like to proceed with a CT scan of the abdomen pelvis or ultrasound of the abdomen pelvis, as you please. So if they have given you a lot of information, then it is not preferred to ask them, unless you really think you want to make sure that that particular information would change your way of thought process. For example, we have a 55-year-old female who presents to the ER with nausea, emesis, no flatus for 5 days, and on examination, she's very distended. There are no hernias palpable. So in this case, you know that the patient is bowel obstruction and has a virgin abdomen because the patient does not have any past medical or surgical history if the examiners have told you. Now, even in this case, you can say, though you have provided me a detailed history and physical examination, I would like to make sure this patient does not have any inguinal or femoral or internal hernias, as she has no past surgical history and I'm concerned that she may have a hernia. Now, even though they told us there are no hernias on examinations, it's okay to ask because you want to make sure you have not missed it. You want to make sure that you tell them that how important that part of your physical examination is. Versus, there's a 55-year-old female who has a breast cancer diagnosis that was diagnosed about a year ago. She does not have any family history of any breast cancer. She does not take any oral contraceptive pills, and she already had a lumpectomy. Now, in this case, they want to see how you proceed after lumpectomy. So you cannot ask them, so I'm going to make sure the patient does not have a family history of any breast cancer because they have already told you. I think the bigger issue is we have to trust the examiners, what they're saying. If they've told us that there is no past medical history or past surgical history, it means there is no past medical or past surgical history. However, if there is something you want to emphasize or talk to them about, you're allowed to ask them. They may have to repeat it, but it's okay. It just shows your thought process.